So what you see, open. Okay, you go. So what you're seeing here is a hemangioma, and he's already had. अभी तक एक ऑपरेशन हुआ कि दो?
एक ऑपरेशन.
एक ही ऑपरेशन. And in the operation you see the lip has been deformed. There's a lot of scar here. So we're going to do some work around this lip, correct this. We're going to take care of this swelling and also the swelling on the nose. And there's some swelling inside the nose also, you can see. And okay. நீங்க ஒரு எப்படி பேசுவீங்க?
எனக்கு தெலுங்கு தெரியாது, கொஞ்சம் தெரிஞ்ச இங்கிலீஷ் தான் பேசிட்டு இருக்கேன்.
मैं आपको हिंदी में बताऊं?
सर इंग्लिश में.
English is better? So very good. So we're going to take care of this. Okay, I can correct this and give you much better nose, almost 90%, 100%. Then here also I will do surgery and correct it. Lip also we can improve. They have spoiled the shape of your lip. I will try and correct the shape to a much better look.
Sir, I have seen pictures.
Open. Open your mouth. Bite. 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 Okay. Don't worry, no. I can correct.
थोड़ा लेफ्ट साइड, थोड़ा क्रॉस. हाँ. Yeah, if you can just share.
No, tomorrow or next week?
సర్జరీ ఎప్పుడు చేస్తారండి? yes yes I understand.
You tell me Telugu, I understand Telugu.
Your opinion, sir?
I can do next week.
We can. Sir, we are coming from long distance, sir. Andhra Pradesh.
Okay.
So reservation problem करता sir.
Then what you want to do? Tomorrow.
Tomorrow or today.
No, today not possible.
Sir.
Major surgery.
Sir.
This is not minor surgery. Tomorrow possible. Tomorrow we have a girl, right? She's doing geno and also 3-4 hours.
Sir, 100% it is successful.
90.
90%. So nose job.
Yes. Yes. Everything I will do. Nose, cheek, lip, everything.
After the trauma, his nose got bent. That time he did not get operated.
No, the hemangioma part is the issue here, not the accident part. So this is the hemangioma. They've resected like this, something what they've done. So it's a very challenging case we're going to do. He's had multiple procedures for this large hemangioma or an AV malformation. I use both the words because he's had 2 diagnoses from 2 earlier reports. He's had embolization, he's had multiple procedures, and he's still got a residual deformity. So I'm going to be working on the nose. We're going to take care of this, we're going to take care of this, and also improvement on the lip for aesthetic and functional purposes alone. So you see here, his lip has become shortened, his commissure is kind of not in the place it should be. And you can see it doesn't even move well. So we're going to try and get that sorted also. So I think we should be able to give him a significant improvement, a huge improvement. சும்மாலாம் சரியாது. நான் சரி அவங்க வேற ஃபோட்டோஸ் வீடியோஸில் பார்க்க சொல்லுவாங்க. ஃபுல்லாக சரியாயிடும். அதான் மேஜர் சர்ஜரி சொல்கிறேன்.
சரிதான்.
ஒரு வாரம் தங்குற மாதிரி இருக்கும் சொல்லுவாங்க.
Sir, if you arrange any blood.
Yeah, we will arrange everything. You don't worry. That all they will do. Not a problem. 1 unit blood, everything. That is easy. 5-minute phone call is arranged. You don't worry about all that.